so you guys can see. And so I want to make sure that I inspect the patient and inspect their abdomen and make sure that there is no lesions, no wounds, no exudate. I want to make sure that there's no excessive bruising from the insulin, from multiple insulin injections. I'm trying to get this camera angle. From multiple insulin injections. And so now I am making sure the skin is clean and intact, which it is. I made sure that we have the right patient, the right dose. We are doing this at the right time as the prescribed order. And we are doing the right route. So subcutaneous, we are going to have that subcutaneous injection going into your abdominal tissue. And then we are going to have your tablet, the Tylenol. It is going to be by mouth. And I believe I already asked you, but I'll ask you again. Do you have any difficulty swallowing? No difficulty swallowing? Okay, great. Any difficulty swallowing? No difficulty swallowing? Okay. And so now I want to ask if you have a preference on which, no difficulty swallowing because it will be by mouth, and I will make sure that they have water available to them to take this medication. Do you have a preference on which medication you would like to take first, or that you would like to receive first? You want to do the insulin first? Okay, great. So my insulin has already been drawn up. I'm going to make sure I do hand hygiene. I'm going to make sure I have my gloves. And then I am going to get my syringe. Well, I would actually get an antiseptic swab or a cloth, or I'm sorry, not a cloth, an alcohol wipe. And I would take that alcohol wipe and rub in a circular motion on the patient's stomach, and make sure that I am not going back and forth or anything and moving any germs back into the site that I'm going to inject. So I would already be gloved, clean. I have already checked my insulin. It is drawn up to that 5 units. I am going to pinch the skin. I don't know if you guys can see that. I'm going to pinch the skin. I'm going to go a little to the left above the umbilicus, and I am going to make sure that my syringe is uncapped. I'm going to pinch the skin. I'm going to be going in at a 45-degree angle for the subcutaneous injection, and I'm going to pinch the skin, and I'm going to go right in, and then I'm going to let go of the skin. I'm going to stabilize my my syringe, and I'm going to push down on it. I'm going to hold it there for about a minute, and then I'm going to come out the same way that I went in. And so at that point, I would activate my safety. I would throw it in the sharps. I would throw it in the sharps, and then I would get a piece of gauze to have them apply pressure to the site where I just injected that insulin. And then I would make sure that I did the proper cleanup as far as Band-Aids and any additional wiping. And so now that that is done, I would sit my patient up. I would have cleaned my hands, sat my patient up at about a 30 to 45-degree angle, and I would be ready to administer their acetaminophen. Acetaminophen is going to be by mouth. It is PO. We have checked the order already. I am going to give my patient the medicine for him to take, or for her to take, and as you take this medicine, I'm just going to watch you, make sure that you take it, and then that should be all. Okay. So she took the medicine, and I'm going to want to make sure that I thank the patient. So thank you, and ask you if you are in any pain, or if you need anything right now, any comforting measures. I would also like to document all of this to make sure that I have the right documentation that she, in fact, did get the medication administered by me at the right time, in the right route, and the right dose. All right, thank you.